Good afternoon, my name is Victoria Gill. I will be presenting my chiral molecule case study. The molecule that I chose for this case study is commonly referred to as tranexamic acid, or more commonly referred to in medicine as TXA. This is a chemical that's very clinically relevant, particularly in my line of work as a soccer medic. It's part of my damage control resuscitation protocol. Any patient that is in hemorrhagic shock, we give 2 grams of TXA along with our blood products and calcium, whether you carry calcium chloride or gluconate. This chemical is extremely clinically relevant in battlefield medicine and also clinical medicine. It can be given intravenously, intraosseously, intramuscularly. It can even be nebulized. There's been instances where a patient comes in with hemorrhage post-tonsillectomy. The risk of hemorrhage is very high post that procedure, so they'll nebulize TXA and give it to the patient. Basically, what this chemical does is inhibits clot lysis. Excuse me. It inhibits clot lysis. Sometimes medics will erroneously misconstrue that the chemical forms clots. That's really not what it does. It really just maintains your clotting factors and encourages clots to form. It's particularly important with patients with a non-compressible hemorrhage, especially in battlefield medicine, where if there's not a hemorrhage that's amenable to a tourniquet or packing, really giving TXA and blood products is all you can do until they are medevaced to higher care where they can have surgical interventions. So TXA is important in patients with a severe TBI with intracranial hemorrhage, a complicated pelvic fracture that maybe has severed the femoral artery, intra-abdominal or retroperitoneal bleeds. So this is a very clinically relevant chiral molecule. So the IUPAC name is trans-4-aminomethyl cyclohexane 1-carboxylic acid. So that already keys us into the functional groups in this molecule, so let's draw that out. In advance for my drawing abilities, we have our cyclohexane ring, our amino group. Let's do our carboxyl group. Okay. So there's our structure. We have our amino group at the 4th carbon, cyclohexane ring, and then at the 1st carbon have our carboxyl group. So let's go ahead and find our chiral center. Now, what I like to do is first eliminate any sp, so carbon is triple bonded, sp2 double bond, any sp3, so our methyls and methylenes. No. So let's look here. Let's look at this carbon. So we have oxygen, no H, a hidden H, and a CH right here. So it says 4 different substituents. So we have found a chiral center. Yeah. So let's look at this next one. So we have a CH here, a hidden H, a CH2, and CH2. So 2 are the same, no bueno. Okay, now let's look at this one. We have a CH2 and a CH2, a hidden H, and a CH2. So So we found our chiral center. That's this carbon. Okay, so now let's look at assigning priority groups. So in our carboxyl group up here, we have those oxygens, and that's greater electron cloud density. This will be our first priority group. Coming down, we have these methylenes, nothing special. Then we have this nitrogen in this amino group here. This will have the next highest electron cloud density. This will be 2. And then all methyl or alkyl chains will be 3rd. And so now we can see in the plane of the cyclohexane ring, these functional groups are on opposite sides of the ring. We have one on one side, one on the other side, so this is a geometric isomer in its transform right now. And there is some clinical relevance to what form it's in. As you can see in the name, we use tranexamic acid, the trans form for clinical use. That's its active form. There is a cis form, but it's nearly considered inactive. Studies have shown that about 1 millimeter of the cis form is needed to have any effect, whereas only 50 micrometers of the transform can have that inhibitory effect on clot lysis. So that's the clinical relevance of the geometric form that it's in.